So this video is for anybody that's been discharged from a hospital or a skilled nursing facility. Or it's for a caregiver who's taking care of a loved one that has been discharged from a hospital or skilled nursing facility. So first, if you're in this position, I'm very sorry. Hopefully things will get better soon. The human body is very resilient and can recover from very difficult things. And keep in mind, whether it's you or you're the caregiver, that the day-to-day might not be a huge difference, but as long as you keep trying and keep putting in an effort, the week-to-week will get better and the month-to-month will be significantly better. I've seen it throughout my whole career. As long as people are motivated and put in a great effort, they usually do well and people can recover from really difficult things. So a lot of people are getting discharged home from hospitals and skilled nursing facilities pretty quickly. There's many reasons for that, insurance and hospital and bureaucracy, but it doesn't, for this purpose of this video, it doesn't matter. What matters is that there's a lot of people coming back home and not be in a position where they can optimally take care of themselves and be independent. So this video is broken into 3 parts. I'll put chapters in the details of the video so you can skip ahead if you need to. Chapter 1 is going to be bed mobility or exercises you do lying down. There's some people that this is where they have to start. Even if you're beyond that, some of these exercises might be helpful. The second level is going to be people that are sitting down. You want to get to the edge of the bed or a wheelchair. And then the third level is standing up. And then usually once you get to a point where you're able to stand up, squat, march, and do things like that, you can move more towards traditional physical therapy and just working on your overall endurance and mobility. With this type of situation, the goal isn't perfect movement. It's one of those things, don't let perfect be the enemy of good. It's just about building your overall system, your overall strength. Building what we call your activity tolerance is extremely important. In the beginning, sometimes people can only exercise for 5 to 10 minutes. But as I've seen 1,000 times that, as long as people keep trying, that 10 goes to 15 to 20, 25, and all of a sudden people are exercising for 30 minutes. And that's where people start to really make tremendous gains. Whether you're a caregiver or if you're the one trying to take care of yourself, you want to be diligent and organized with these exercises. So that way, if you're really exhausted or you have too much pain, you can look back and see what you did and change it methodically. If you just randomly choose these exercises I'm about to show and change them every day in the duration, you won't be able to titrate it to your individual needs. If you're a caregiver, caregiving is very difficult. It's quite a role to be in. I do see that people that have loved ones in their life and have people that are there for them with support do a lot better. So even though it's sometimes can be a thankless job, you take some solace knowing that your caregiver role is going to be very profound for the situation. That said, it's also important to take care of yourself. So if you can find the means to get a massage or acupuncture or just time for your personal hobbies, take advantage of that. Because you can't pour from an empty cup. It's like when you get in an airplane, they tell you, if there's an emergency, you put your oxygen mask on first. So while it's important to take care of your loved ones, you also want to make sure you're taking care of yourself. So again, these are separated into 3 sections. You can jump ahead if you need to. It's just going to be a bunch of different exercises. Doing all these would be way too much, so it's just a menu. So maybe depending on where you are on the continuum of rehab, you might need to just start with 4 exercises. Other people might be able to start with a couple from each category. But the big thing is that you just start exercising and start building your strength and endurance. It's one of those things, the only way out is through. So leave a comment, or you can go to my business webpage and contact me there. Be happy to help if you have any questions. Good luck. Ankle pumps should be done almost every hour. They're great for pumping the blood back up to your heart. Some people even call the calf muscle the second heart of the body. Next, go to a quad set where you push down and squeeze your quad muscles. Sometimes I put my hand under people's knees to cue them to push down into it. The next is a glute set where you squeeze your butt muscles. Again, sometimes palpating the muscle, feeling the muscle will help you contract it better. Heel slides are great. You dig down your heel and drag it up towards your butt. This should activate the hamstring muscle. Lumbar trunk rotations are a great exercise for general mobility as well as for lower core control. You can add a head turn to the opposite side to get more spine mobility and to mobilize the nervous system. Bridge is a very important exercise. This works similar muscles to getting out of a chair, going upstairs, and climbing up your steps at home. Just squeeze your butt muscles and push your hips towards the ceiling. The straight leg raise can be a challenging exercise. Focus on squeezing the quad muscle as hard as you can throughout the entire movement. The active hamstring stretch kills two birds with one stone. It'll stretch out the back of the leg while also strengthening your quad. Shoulder flexion will work your upper core. It'll help extend your upper thoracic spine and help prevent any loss in shoulder flexion mobility. You could alternate arms for more variance in exercises. Marching is a great exercise for the lower core. A focus here would be on trying to maintain a stable pelvis and core. This is a very important exercise for people in this situation. It'll help work on bed mobility to help people be able to roll to their side to then be able to sit up. You push through the bent leg and reach with your arm. Seated marching is a great core exercise and hip exercise. This is a great exercise to strengthen the quads. Encourage people to go as far as they can to get to that end range. Some people may be more comfortable with their foot pointed during this exercise. This is a great exercise, again, to pump blood away from your lower extremity. It's also good to strengthen the calves. For this exercise, you can use a pillow or a ball. You just squeeze as hard as you can into the structure between your knees. This is a great exercise for your glutes. You can use either a belt or a band. One level would be just to push out into the band as hard as you can, and you'll feel your glutes work. The next level would be adding some movement for almost a seated clamshell type of exercise. This is a very important exercise for people that have been on bed rest or in a hospital bed for a while. Oftentimes, the ankles get very tight. And when the ankles get tight, it makes it difficult to stand up. So what I have patients do is I'll have them slide their heel back and then lean their body weight through their lower extremities. They should feel a big stretch. Sometimes I'll push down through their knees to give them a further stretch. Unsupported sitting is a great core exercise. Simply just doing this can be a lot for some people. The next level would be to add different movements to this. You could add just head turns, which will challenge your vestibular system. Then you can add thoracic rotations, which will work their core a little bit more. And then you can add reaches to really challenge your core. Going across the body will be even more challenging for their core. If you get bands, you can add many, many more exercises. This is a hamstring curl where you simply pull the leg back. A caregiver can hold it or you can put it up against the door. Rows are a great exercise for posture and strengthening the upper back. This pattern will help open up the upper back and strengthen the shoulders as well. Biceps and triceps can also easily be done with a band. Just focus on trying to maintain a nice upright posture. Bilateral external rotation will also improve your posture and the posterior shoulder. Horizontal shoulder abduction will do the same, just with different muscles. The sit to stand might be the most important exercise. What you want to do is you want to go to your kitchen sink and pull up and try to work on your ability to go from a sit to stand. There's even some studies that correlate outcomes with the ability to do this exercise. Make sure this is a focus of your home exercise program. You can check to see how you're doing every once in a while about crossing your arms and trying to do it without upper extremity support. The next standing exercise is weight shift. Simply shift your weight side to side. This will help prepare your body for walking. Going forward and back can be trickier than it looks. The key is just to let the weight go from your big toe back to the heel. Sometimes people will lose their balance with that forward back one, and it's important to do it in a safe area or with a caregiver. Marching is a great exercise. The benefit of this is that when you lift one leg, the other leg has to support the whole body weight. And once somebody can do this exercise, they're probably pretty close to being able to walk. You may need to start with small steps before going towards bigger steps. Hip abduction will work the side to side plane and also that single leg stance support. The hamstring curl will start to prepare your body for swing phase of gait,
It will also help to stretch the front of your thighs. And the calf raise will again push blood back from your lower extremity, as well as strengthen your legs to push your body forward when you start to walk. The side to side step is another great exercise to work on core stability and hip strength.